Hi, welcome to BariNation, where we support the bariatric community with humor, humility, and honesty.
You've just tuned into a podcast that welcomes you into a community, a resource center, and a safe place that powers your journey towards personal wellness.
Our goal is you leave us today feeling hopeful, inspired, and ready to live your best bariatric life.
Hi, friends. Welcome to the BariNation podcast. We have not been this excited for an episode in some time. We get to introduce you to a brand new bariatric surgeon who we got to meet this last year at ASMBS. Her name is Dr. Shariff, and she goes by Robot Queen. And after this episode, I think you're going to understand why. She's an absolute amazing human being who is here to advocate for anybody suffering from the disease of obesity. And the very first time I met her, maybe the second time, she said something to me that stopped me in my tracks. I think I messaged Jason and Natalie instantly. And I said, guys, you won't believe who I just met. And here's what she said. Obesity isn't your fault, but it's your fight. Absolute mic drop, mind blown, world changing moment. So today's conversation is about that. Why obesity is not our fault, but once we understand that we're fighting this disease, it does become our fight. So before we dive into that conversation, Dr. Shariff, will you introduce yourself?
Hi, thank you all for having me here. I'm Dr. Faiz Shariff, an obesity medicine physician first, and a bariatric surgeon. And I am absolutely passionate about obesity. And I really did not realize how passionate I was about this. And I think the more I practice this, I feel more drawn towards it. Maybe it's because patients suffer in silence a lot of the time. And it just breaks my heart that you have treatments, you have options for them. And for some reason, they have in their head gotten into this place where they keep thinking that this is something that they did to themselves without understanding the science. Now I've been practicing for 5 years, plus my residency, plus fellowship, all of those, 10 plus years. The more I understand about obesity, the science behind it, the more you realize what I said to you, it's not your fault. And another thing I want to add is this is one of the most stigmatized disease now after AIDS. And I don't think it's as stigmatized. I take care of patients who have a stigmatizing disease. So yeah, that's the reason why I do what I do.
And since I first met you, right, we've been following you on social. We've had a lot of wonderful conversations with you. And the passion that you bring forward in treating people with the disease, I really do think allows us all to continue to drop the shame and the stigma, right? To embrace this. It's not my fault, but this is my fight. Jason and Nat, before we really dive into this conversation, would you agree with what Dr. Shariff said, right? This is very stigmatized, right? Patients are very isolated. They still feel that, right? We're shaking our heads.
100%.
Do you, right? Jason, how many years did it take you to make the decision to undergo bariatric surgery?
I'm going to say 7. 7 solid, because there was 5 of it that the first 2, I was kind of thinking maybe it could be a possibility. The last 5, I was, I'll do it on my own. I can do this. I got myself here. I can get myself out. All those things that we tell ourselves that are crazy. And then eventually kind of came around to it. But I also am of the opinion, as I've thought about it in terms to myself, is that I think had I had it earlier than when I did have it, I don't know that I would have been as successful because my mindset wasn't there. I was very defiant in my obesity and thinking that, nobody's going to tell me how to eat, what to eat, when to eat, where to eat. And I was just going to do what I wanted to do because it wasn't hurting anybody. This was my own situation. So I'm fortunate enough for it to have been as successful as it was at the time that I did have.
Jason, I'm really thankful that you said that because I think the word defiant fits into this conversation today. We don't want to believe or we don't want to understand that this is not our fault because we have been raised in a society that is constantly telling us it is our fault. So that defiance can come just because of how we were raised. And our hope with this conversation today is that you leave it just embracing more of the understanding that this is truly a disease. You didn't choose it. You didn't opt into this, and the things that you've done in your life have not necessarily caused this. But once we make that shift in understanding that this is a disease, we need to fight it with everything that we have.
Absolutely.
All right, friends. Well, let's get going. Let's dive in.
All right. So I know Jason touched on his story and, that defiance that we all have as patients. Truly, as we mentioned before we recorded, I've had 3 bariatric surgeries. My first 2 were adolescent surgeries. I was 350 pounds at age 15, had the lap band. It was great. That didn't work out for me after a year or 2. And then I had application. That didn't work out for me. I felt like I couldn't win. I felt like my disease, my obesity, I thought that I was choosing it. I thought, well, I'm just supposed to be big my whole life. I thought I'm supposed to be sick my whole life. This is just what it is, brush my hands of it until I realized and came to that realization that it's a disease that we're fighting, and had my 3rd surgery in 2020. But why is obesity not our fault? How can you explain that to someone maybe listening who is struggling with these thoughts that April, Jason, and I have all had?
I'm so glad you asked me that question. Why is it not your fault? So I think it has to first, let's start off with why we think it's our fault. Let's start from there. In the past 20 to 30 years, we have done a whole lot of research and we now know it's not. But it starts out with this whole idea that obesity is the paradigm where calories in, calories out equals calories out. That equation is ingrained in our heads. Oh, it's simple equation, right? Calories in, calories out. And in the last 20 to 30 years, the paradigm has shifted. So when you say calories in, calories out, it just kind of goes into your head where you think it's about willpower. If I'm strong-willed, I can do this. And if you look at everything that happens in your career, anywhere else, you got to be strong-willed to be successful. So I think everyone wants to believe that they're strong. And when the reality doesn't meet what the expectations are, that's when they start feeling like a failure. And they don't want to admit that. That's where the defiance that you had comes from. Because how can I be a failure, right? How can this happen to me? I'm strong-willed. I can lead a successful life, but when it comes to that food, how is that? So
Yeah.
Let's first understand why we believe or patients believe that it's your fault. And I think that comes from the paradigm or the teaching that calories in, calories out, that equation, which is made to seem so simple, right? What you eat is, if you burn that off, that's fine. But what we now know is that in the past 20 to 30 years, research has emerged which shows that the calories, your 1 calorie is not the same as mine. So when you live your whole life with this equation where calories in and calories out is the truth that you live by, you think it's all about your willpower. So it's all here. And everyone says, and everyone talks about this mindset, if you're strong-willed, you're going to succeed. So patients don't want to feel like they don't want to feel like a failure. And that's where the defiance comes from, right? You think you can succeed, so you're going to try everything and suffer in silence. And what you don't realize while you're getting all these physiological and physical changes, what it's doing to your brain, how you become socially averse and avoid social gatherings. So now let's see why do I say it's not your fault? I would give you 3 distinct reasons. First, we know a lot of research has gone into genetics and epigenetics. And I actually made a video on this that's going to come out this month on what your genes do. So we know that 70% of obesity is related to your genetic makeup. What I mean, yes, 70% of obesity is related to your genetic makeup. So we are all born with very similar genes. So there are 2 kinds of obesity if you want to dig deep. So one is called the monogenic. So that's one gene that signaling goes wrong. And that gives you a very resistant form of obesity. But that's just the minority of obesity. Majority, most of us have, is what's called polygenic, meaning to say multiple genes, just a little bit of changes. And the way I like to explain is, think of your house, okay? Your house has wiring, it has set lights. Now, we all have the same DNA, but it depends on the gene expression that matters. So it's like turning the switch on and turning some switches off. So your environment plays a huge role. And what has happened over a period of time during evolution is we have accumulated these genes that make us energy efficient. Why? Because it provided survival benefit. If I would eat less food, then I had survival advantage over you in the time of war, in the time of famine. So over the centuries, we have accumulated these genes that make us very energy efficient. But since about World War II, everything became automized, right? Food was available 24/7. We don't have scarcity of food. And we have access to food 24/7. Look at our refrigerator, right? We have access to food. So now our genetics hasn't kept up with the changes in the environment. Genes don't change that fast. Maybe in 2 centuries, maybe our genetics will evolve. But that's what happens. So now you are someone who conserves energy. So no matter what you eat, you can still find ways to conserve energy. And what that then does is body stores excess energy as what we call fat or adipose tissue. Now, these adipose tissue, and I hope I'm making it very simple. I try to make it really simple for everyone to understand. But if I throw in some big words, just let me know. I'll correct you. I'll correct myself. I don't know. Okay. So now you're conserving that energy, right? That is converted to fat. And that fat is not sitting there just making you look bigger, right? What that fat does is it's very active. It produces chemicals. And there are two sets of chemicals, big groups of chemicals that it produces. One is hormones. We know leptin. Leptin is a hormone that is produced by your fat cells. And its function is to work with your brain. So it's like going to the CEO, giving you feedback. But that signaling is the problem. So now the CEO of the house gets a wrong, or CEO of your body gets a wrong message. And when we all know, we all work in an organization, when the CEO gets wrong message, what happens? The wrong targets are set in. So instead of your set point being in the normal range, it's now elevated, right? So once that set point is elevated, it's like a bridge that has been crossed and you can't come back. So you can do all the diets, you can do all the exercises, 99% of the time patients struggle and fail with that. Okay, so we talked about one of these hormones. Now that particular leptin, resistance leads to other hormonal imbalances like insulin. And I can give you 25 different ones, including GLP-1s, which levels go down. So that's hormonal imbalance on one side. The other set of chemicals, what it does is it produces inflammation. What is inflammation? Anytime you get bruising, you have that bruise, you touch that bruise, it bleeds, but normal skin doesn't bleed. That's because you have inflammation going on. Imagine all your organs floating in that inflammation. What does it do to that? So that's where you have your heart diseases. That's where you have your liver diseases, all of those coming in. So it's a hormonal imbalance and the inflammation that leads to all these medical problems. So this is where I'd say people have to think of obesity as a chronic disease. The bigger, the analogy I like to use is like a cancer. And cancer analogy fits in so many places with obesity that it makes it simpler for someone who's first time looking at into getting treatment will see. You would sit at home if you had cancer. Now, when someone gives you a diagnosis of cancer, you're allowed to feel bad, but you don't feel guilty, right? So why do we do that with obesity?
This is a question that we talk about and we attempt to answer all the time. And it absolutely seems like one of the last diseases on the planet that doesn't have this like resonance. People don't take it seriously because they think that other people's actions are driving their what's going on in their body. Right? But just as you said, I just want to recap this to make sure that we're all understanding this. The disease of obesity, right, is driven by genetics. And it sounds like research is saying 70% of the disease of obesity comes from genetics alone. And we know we can't do anything to alter our genetics. So if we have this genetic issue, it's not allowing the regular or normal, right, hormonal signals to go throughout our body. And though that misfiring impacts everything else about it. So
Right.
all of our lived experience, right, Jason, Nat, and myself, I know the three of us did everything and anything we could do out there to attempt to lower our body fat, right? We wanted to lose weight. And every time we saw any decrease in that, it would come right back. And it goes back to this willpower, you know.
Set point.
Yep.
Your set point. Your
Yeah.
set point. Your body has decided this is going to be a set point. You do everything, brings it back. You look this way, boom. Because the marching orders for your body has been set at this point. So that's called the set point theory. I just want to make one little addition. You can change your genetics because it is not just change. The 70% what I said was it's to do with your epigenetics, and environment plays a huge role in that. So there are ways, and you know what? There's a message of hope. Bariatric surgery actually changes that epigenetics. So if you are someone who had obesity and then had bariatric surgery and then have kids, your chances of passing on the bad genes or the bad expression of the genes, if you want to be very technical, goes down.
Really? So as we're sitting here listening to this conversation, the numbers for people onboarding bariatric surgery have not improved.
Yeah.
Why? Why are more people not accessing this meaningful treatment for this disease, which you have just told us is very much out of our control?
I think it's the stigma and the fear. I would say 80%. I mean, I don't have a paper to quote, but in my experience, every time. So when I first talk to a patient and when they come in, I say, tell me what inspired you to come see me today? They always come with this mindset that they have failed, and that's when they are coming here. It's very rare. People are like, oh, you know what? Obesity, I read about it and I found out, or someone told me about this. It's super rare for them to find. I mean, I do have some, but very rare. And it's because I think what happens is when you're looking at the disease of obesity, right? You kind of equate that with weight. Weight is a symptom. Obesity is a disease. Fever is a symptom. Pneumonia is a disease. If I just keep focusing on fever and taking someone's fever down, I'm not addressing pneumonia. So that's number one. Now, next thing is access and coverage. Let me ask you, for obesity, the insurances, and we can have a whole different podcast on insurances and coverage. My question, and I have asked this at ACA to ASMBS leadership. ASMBS, like you guys know, is like biggest national society. We are doing a lot of things to get more coverage, including for medicines and everything else. And we should be allowed, it shouldn't be one lifetime kind of procedure. Like you have Natalie and Jason here who got multiple surgeries. But again, to carry that forward, what about plastic surgery for the excess skin that needs to be included in that care? So you see how the stigma is. If someone has breast cancer and then have the mastectomy, right? And then need a reconstruction, that's all covered. But my patients who have done an amazing job losing weight and, done absolutely everything by the book cannot get all of the excess skin removed.
Yeah.
And again, that comes back to stigma.
Yeah.
Because body dysmorphia is a real problem. And I think the last thing I would like to say is kind of clubs into the same thing: misinformation and lack of education. Lack of education in elementary school, high school, primary school, lack of education in medical schools. So if you speak to our medical doctors, because these are going to be other providers, right? Like I work with my PCPs, I work with my specialists. A lot of times you will be surprised how many times they've said, oh, you're letting them take the easy way out. I mean, they don't realize how passionate I am. And then they'll be spending half an hour with me talking to them about it. But that is the reality of things. I think it is to do with stigma and fear that comes in with this. And then I also think if you want to get deep, previously, when we used to do bariatric surgery, we were mostly acting like technicians a lot of the time. We do surgery and then it was someone else's. Now, I think most bariatric surgeons are very passionate about this. And that's why I went to get my ABOM, which is the medicine exam, because I want to understand the disease from the genetic till the end. Like, I want to be the expert in this disease, not just doing surgeries. Yes, I love doing surgeries. I mean, come on, I'm a surgeon. But it's amazing. That's why I said, the more I read about this disease, the more I realize it's not your fault. Yeah. It's really not.
No.
So, yeah. It's to do with the stigma, access of care, misinformation. I would say the top 3 reasons.
Well, and there are so many, you talked about the access to care, and we talk about that a lot. A lot of it feeds to, there's like, this is a last resort for a lot of people, myself included. You feel like you tried everything, and you're just at the end of your rope. And then you're met with, oh, now we get to do the insurance, play the insurance game and jump through these hoops. And eventually, you just get tired. You just don't want to do it. You don't want one more appointment. You don't want one more hoop. You don't want to go to this building or that building or talk to this person or that person. You've done all the things that you thought you had to do. And then there's, oh, well, we were going to cover it, but now you got to do this, or something's changed and this is this. And it just, people get to a point. I mean, we were exhausted when it started, and then you just have more hoops to try to jump through. And it's just one of those things that people just get worn out. And if you're lucky enough to get the once in a lifetime coverage, most people just don't cover it at all. They're just like, be fat and die. We don't care. It's not our problem. You should eat less, move more. That'll be the thing. Like they're still using the old outdated model. They just don't want to pay for it. And it's very hard for people to, and then that just kind of plays into people's self-talk about how it is their fault. Well, if I just wouldn't have done this to myself, I wouldn't have needed this. And that's the insurance company's telling me the same thing. So why is that not the truth? And there's so many things wrapped up into the psyche of what it takes to be a bariatric patient, or what it takes to live with the disease of obesity. And the more that April, Natalie, and myself kind of dig into this fight and find more people that align with our values and what we see for the community moving forward, it just helps to kind of shine a brighter light on the fact that it's not our fault, that we are fighting the good fight for the right reasons. And, it's a disease, genetics, things play into it. And it's not just about the fact that we couldn't push away from the table.
And to that point, not to beat a dead horse here, but I am a direct, and I know so many other people are too, but I'm a direct result of the insurance game. I went through in 2017, 2018, after about 6 years being without, or realizing my second surgery had not worked for me. I decided, okay, enough's enough. I got the information back. I went through 2 rounds with 2 different hospitals of the insurance game and got denied twice. Back to back. I thought, okay, I'll try again. I'll do another 6 months. I'll try this different hospital. And I got denied again. And so my third surgery in 2020, 2 years later, was in Mexico. I self-paid because I was just like, I'm just going to do this because I need it. And if they're not going to pay for it, I'm just going to get care somewhere else. But I know that that's not feasible for millions of people. But we're at this crossroads, and how can we not feel like it's our fault? How can we not feel like it's our fault when we're getting denied by insurance, when we're doing the things that we have to do? Oh no, sorry, it's still not good enough. Try again. Like, how are we supposed to not take that personally?
I hear you. I truly hear you, what you're saying. And if you look at each of the insurance requirements, I mean, there is a requirement that you can't gain more weight. My question to them is, if I'm taking care of someone's cancer, right? I have a CT scan and I ask them to go through some clearances. In the meantime, the cancer grows bigger. Are they going to then tell me, oh, you can't do the surgery?
Thank you. Thank you. This is what we say all the time. This is the only disease that you are denied immediate and meaningful care for.
Right. And there are so many hoops. So I'm going to share a story, and I have my permission from my patient to share. I won't take her name, but this patient has bad diabetes, like real bad, developing retinopathy. She's on, I don't even know, hundreds of units of insulin. One thing that'll help her the most is bariatric surgery. So when she went through psychological evaluation, and she was denied because she said, they asked her, how do you feel about becoming blind? And I mean, she might have said something to the extent that, it's depressing. Sometimes I don't think it's worth living. Without realizing you're denying the very treatment that's going to help her in the long run. Mm-hmm. It all has to do with the stigma. I mean, at the base, at the core of it, it's the stigma that is there. We take care of, in the emergency department, we take care of patients who might have had, who would have been drinking and driving. Mm-hmm. We don't deny care to them. So why this higher standards or double standards for patients who have obesity? And believe me when I say patients are like, oh, when they eat like gluttons or they constantly eat. Do you understand what the pathophysiology behind that is? If you have insulin resistance, it constantly makes you eat. Mm-hmm. So that's something else that I try to talk to my patients about. Helping them understand why they do what they do helps address that stigma. So I ask them, are you like someone who, stuffs throughout the day and then the floodgates open and you don't know how to stop? Or are you the kind who eats constantly? Because there can be two different hormonal imbalances that are going on. One could be insulin resistance that constantly makes you eat throughout the day, snacking. Or you might have high levels of ghrelin, where you open your floodgates and you could be sick.
Yeah.
And also what happens is someone who's suffering at a young age, what does it do to their psychology? The eating disorders that are coming. So you gotta have, that's why I feel like obesity care, and I don't like to use the word bariatrics because it kind of minimizes what we are doing. It's more metabolic care. Has to be multi-pronged, right? You need to have your dietitians because a lot of times our schools don't do a good job educating about nutrition, mm-hmm. which is another battle that we have to fight. I am worried about the next generation that's coming along. If you look, if you go to my son's school, I can see what the problem's going to be. Yeah. And it's a good school. Like he goes to a good school, right? Imagine what happens in inner city schools.
Yeah. Jason, you talked about the amount of energy and effort that patients have already put in, right, to managing their weight. Let's just say that, right? And you look on the horizon for what bariatric surgery would require you to do. You nailed it on the head when you said people are already exhausted when they are in front of a bariatric surgeon or an obesity medicine specialist. And the sheer amount of energy that it took to even shift the thinking from that I could never do that, it's too scary, it's not for me, to actually making that appointment requires a ton of work.
Yeah.
And the thing that popped into my brain as you were saying that, Jason, and even Nat too, when you look on any feed, any social media feed, anywhere that your eyeballs go, you are more than likely going to see an ad for something that promises to be the thing.
Right.
Right. And it just feels like it is going to take less energy to try this one more thing than it is to do what I inherently know is a big thing, which is undergo metabolic and bariatric surgery.
Yeah.
So, right, there's this constant push and pull because at the heart of what we seek is people suffering from the disease of obesity. And even if you don't think it's a disease yet, that's fine. You want relief from this thing that you have not figured out yet. And you are always torn between, I know that this is going to be really hard work, but I'm already exhausted and I just want something to be a little bit easier for me to get through this. Right. So this thing that we think up here about like, oh, it can't be easy. And I need to work hard at this, but I'm just exhausted and I want something to be easier. There is such a disconnect between doing another diet, thinking it's going to be easier, or just onboarding the thing that has
100%.
been proven time and time and time again to be the most effective and extremely safe and all of these things. And I often wonder if that other thing in the back of the head is like, well, but if I just do surgery, then I'm not actually working. They're just going to make my stomach smaller and then boom, everything's going to be fine. Yeah. So it's like you're having this weird conversation with yourself.
Well, and I also know that from talking to people and myself included, it's the finality of it. A diet you can start and stop whenever you want. The finality of going in and having surgery and doing this is a final step. Like you can't go back and reverse these things. And so people think about that in such a monumental way. And like what you're talking about, what's so funny is when I think about what it takes to go through another one of the diets that I went through before I had surgery versus the 15-minute infomercial I had to watch and then call to make an appointment and go to the appointment is hilarious to me, because I watched that little webinar 3 times before I called back to make the appointment. And it was over, it took a week. I watched it, Monday, then I watched it again on Wednesday, then I watched it again on Friday, then I went ahead and made the appointment on Monday. But if I think about that in terms of that versus thinking of buying, prepping, going through, meal prep and doing the containers and all the crap for another diet, it's just exhausting to think about. But it's also not so final, because if I decide to start the diet on Monday, and by Wednesday, if I'm like, this sucks, I pull the chutes on it, I don't do it anymore. If I go in, like a lot of us do, we go in and have surgery, then a couple of weeks later, we have buyer's remorse and go, what did I do to myself? You can't just pull the chutes on that. You got to go, oh, well, I'm just going to sit in this now and figure out how I'm going to live the rest of my life like this. So I think that really plays a big part into it, more than, there's the stigma, there's all the other things too, but the finality of it is what I hear people talk about the most.
And I think that's one of the reasons why patients want to try medications first before going in for surgery, because they think it's permanent. But it's important to understand, every time you've gone through those diets, right? Every time you've done those things, you're changing the way your body reacts the next time around when you do that. It's called adaptive thermogenesis. So you'll see the first time you try to lose weight, great. But then the next time it becomes harder. There's a good study by NIH that did on Biggest Losers. And what they saw was they followed these contestants before they went into the program. They got their, resting metabolic rate. I think it was 2,100 or something, average rate. And then they went through this program, lost 100 pounds on an average. And then the resting metabolic rate came down to 1,900, which is expected. Now they're not carrying, they have 100 pounds less. So they followed them for 6 years. And all of their weight had come back, barring 5 to 10 pounds. And what they found was that the resting metabolic rate didn't come back to 2,100. It wasn't even at 1,900. It was 1,800. What does that mean? Now you are going to have the same weight and you're going to use lesser calories. So that's something that keeps happening time and time and again. So this is why people have to understand what I'm not against dieting. I don't like the word dieting, because dieting somehow seems like a punishment, right? Mm-hmm. If you think of it like a small lifestyle changes, small sustainable changes, that's what helps you become successful. Be it in anything in life, no matter, set your target and then let it be, right? You have your goal, set your target, but small sustainable steps. When a patient comes overwhelmed with, everything that they have to go for the bariatric program, I said, take one step at a time. You've come and seen me. So that's a big box. Now, one step at a time. And know that before surgery, things are much harder. Much harder. When they say, I don't know, eat, chew 30 times, or you're going to eat like portion sizes and everything. How are you supposed to understand? Your hormones haven't changed inside you. Your body's screaming by the end of the day. And you're supposed to. So I always say, I know the dietitians are going to go through this. You just think of your pre-surgery, program as getting tools. you want to have all these tools to be successful after surgery. And I do talk to them about bias remorse. I actually make a joke. I tell my patients the first week after surgery, you're going to hate me. You'll have bias remorse. And I want on all their partners. And it's not even like they're going to be in pain or anything. It's just that bluff feeling. I mean, those of us who have had babies, after pregnancy, you have a baby, you look at the baby and the baby is beautiful. And then you're like, you're still not happy. You don't understand that, right? Like, why? That's because hormones are changing inside you, people. That's everything. I mean, there might be tiny scars, but a storm is going through you. And then I say, first week, you don't like me. First month, you're like kind of assessing, she's nice, And then by 6 months, we're best friends. So that's something that people have to understand. It's a process. It's a process. And it kind of makes it important for you to know who to go to. How do I say it? People have to be invested in this disease and understanding where the patient comes from. I mean, I do hear a lot of time, some of my residents who don't understand, they're like, oh, your patients are like, needy or something. I'm sorry. That's the first time someone has actually believed in them and not said that this was your fault, right? So yes, they will look to me for all the other smaller things, but you can't fail them at that point. So this is where I just say to people who are looking to take the first step, do your research. Find out what they have to offer. And it's the long-term care that matters. If someone has to be successful, it's the long-term care. And I'm sure you guys can talk about that.
Absolutely. And I'm so glad that you said all of this. It sounds like I'm listening to myself. I lead one of the beginner bariatrics meetups in BariNation. And, I see folks who are just signed up, like just are saying yes to surgery, and they get their pre-op, we call it a pre-op diet, whatever that looks like. And they go, how in the world am I going to do this? And I just look at them and say, you're doing this while also fighting your disease. So this is going to be, it's going to be a tough, however many weeks it's going to be. Yeah. And then you're going to have the surgery, and then you're going to eat similarly to how you are now. And you're going to go, oh, this is actually doable. But it's a one step at a time. And the whole time you have to remind yourself, it's not my fault that I'm here. It's a disease. I'm treating my disease. During my pre-op diet, I'm treating my disease. I'm one step closer to getting surgery and moving forward. But I love that you said all of that, because it's just true.
So with regards to the pre-op diet that a lot of our patients struggle with, I just want them to understand you're doing this diet for two reasons. One reason is to shrink that liver. The liver sits on top of the stomach, and you want to make my life easy, right? You don't want to make me work so hard fighting that big liver, So that's one reason that you do. And precisely like you said, if I haven't changed anything inside of you, why would it be easy? You got to understand. And I tell them the diet that you're going to do, you're going to struggle, but it'll make you realize how easy it is afterwards. Because now your taste buds have changed. Do you know your gut bacteria changes after surgery? So there's a whole lot of changes that are going to happen in your body, and it makes it easier for you to follow that. Now is the time, like the pre-op diet is, or the pre-op program is for you to understand what good life looks like, right? You want to make a note, you want to do this. Sometimes you're doing these actions, the 30, don't drink before and after. Like, what does that mean? Kind of thing. But it all falls into place after surgery. Right? So, yeah.
And when you're in that stage looking forward, it's hard to imagine the life that is going to be waiting on the other side of you, because your only experience that you have in life is fighting a disease that you never had a proper tool, right? Or an adequate weapon to use. And this concept of fighting also means something very different to everybody else, right? Some people have never had an experience in their life where they've had to fight back or fight against. Other people have had very different experiences when it comes to the word fighting, what it actually means. But if you really do want to do something different, if you want to finally understand why your body, right, is set up the way that it is and onboard something that will help you, you have to take that leap of faith and you have to say, okay, this is not my fault, but this is my fight. And maybe for the first time in your life, you get to determine how you are bringing your fight to the disease. You get to put yourself in that driver's seat for the very first time, possibly ever. And you get to say, this is how I'm going to fight it. This is how I'm going to battle it. This is what's best for me. And I think this is what is really going to put the disease in its place. And it's hard for us to understand what that's like until you're kind of in the battle. And whereas after surgery, the life and the things and the thoughts that you had for surgery all of a sudden reappear. It's very easy for the disease of obesity to go, see, told you, look, nothing's changed. Nothing's changed. And if you buy into that lie, if you buy into that false narrative that the disease is throwing at you 24/7, it is going to feel the same. And that could lead you down a path that is letting the disease take hold of your life again. But when you partner with the right surgeon, when you have the care team, when you have the support of experts, when you have a community of peers behind you, being that mirror for you going, hey, this is what you're up against, you can fight it and you can fight it for the rest of your life.
100%. I always tell this to my patient. I say, you can't control where you started from, right? But you can control and the strength of where you're going to go, the direction that you're going to go in. And what I tell them is the year that you're going to start this journey, that is a year for you. That is your year. You are your number one priority. Because if you're not healthy, if you're not happy, you can't take care of anyone else. And I see this a lot of times in my patients, that they have put themselves on the back burner, taking care of everyone else. And again, I say, would you have done that if you had cancer? Nope. No one says that, right? But because somehow this is not an important disease or whatever, they put themselves at the back burner. And I say, after this, once you've gone to this journey, another thing that you can do to solidify is now you have this newfound power. For the first time in your life, you feel control. Go get a better job. Go for a promotion. Do something impossible that you never were able to do, right? And this comes down to non-scale wins. So yes, everyone wants the weight off and all that. Again, we're looking at one symptom. So I try to more, I don't give them a target weight. Everyone's disease is different. So I know in my house, the dietitians and everyone else do, but I personally do not give them a target weight. For me, weight is not the issue. I do not give them a target weight. It's not about weight. It's about disease resolutions. Let's see how many medications are we going to stop. It's about flexibility. I actually give them a challenge. I say, you need to sit crisscross on the floor and then get up without touching your hands. That's my target. But then again, I write down, what is one dream that you have? Like silly, whatever, right? That you could do. And it's amazing how many times people come up and tell me different things. Like one patient said, for the first time I went crowdsourcing. Oh, crowd surfing, not sourcing, crowd surfing. Right?
Yeah.
And who would have thought like she wanted to go crowd surfing? She says, my husband always goes on concerts. I went this time. For me, those are more important. You being able to live your life to the fullest and not living your life by a number is important.
Well, you're putting the emphasis on disease treatment where it belongs. And that is improving people's not only quality to life, but access to the life that they've always wanted to live.
Right.
And I think the goal weight throws people off. And Jason and Nat, I would love for us to share this. First question, did your surgeon or care team give you a goal weight? And if you didn't have a goal weight, do you think that would have impacted how you move through your post-op journey?
I didn't have a goal weight with either one of my surgeries. My second surgery, Dr. Joe asked me where I wanted to be. And when I told him what I had in mind, he said that if I really wanted to get there, that it was possible. but not to focus on it and worry about it. He's like, we're trying to just get you down, get you healthy, just like what, what we're talking about here is just the fact that it's about the happy, the healthy, the labs, the metabolic wellness more than it is the umbrella scale. And it made a huge difference in the way I approached it. But I was lucky. I was fortunate enough to not have that goal with anybody.
Okay. Nat, what about you?
I know that it's hard to remember back when I was 15 what my goal weight was. I know I surpassed it due to complications and things like that. My third surgery, I do have a goal weight. I haven't hit it. I think at first it was hard. It was I think it hindered me in some ways of, focusing on the scale. But in other ways, I was able through BariNation, through meeting April and Jason and other folks in this community, I was able to shift that mindset. And so now I'm like, yeah, that would be great. I think I felt, I've been every weight from 130 pounds to 405 pounds. I've been everywhere in between. And I remember feeling really good at the weight that my current surgeon had prescribed me, for lack of better words. So I would love to get there, but I'm also enjoying, I've gone kayaking. I went kayaking with April for the first time. My labs are great. I was telling my mom about a month ago, I said, I feel the best I've ever felt in my life. And I'm not far off from my goal, but I'm also not going to stress about it. But at first I do remember it did stress me out, thinking I had to reach that goal. But I realized that's the old mentality. That's the diet culture mentality. That's the rigorous routine mentality. And I can't live that way. That's not who I am. And that's not ever going to be the case.
I am so glad you guys are all talking my language. I am so happy about this because that's what it is. And I know some people like to have goals, like targets. So I don't give them a weight target. I give them body composition target. I said, let's reduce your body fat, So we get the body comp and then reduce the body fat. Because if you're looking at what leads to long-term success is your body mass, right? That's why we hop on this. Take your proteins. If you have this surgery, 60 to 90 grams, 90 to 120 grams for Sadi-S and all those. It's to do, when your body loses weight, it doesn't differentiate between fat and protein. So you can lose your protein or muscles. So you can use your muscles to during the starvation period. So that's why we insist on getting proteins and resistance training. So if I may add. And for anyone who doesn't want to age, flexibility exercises. The more flexible you are, that's an anti-aging exercise.
So the reason I asked that question is when I was thinking back to all of the diets that I'd tried before bariatric surgery, I always had a number in mind. And that number always tripped me up, right? Because as soon as I didn't reach it, I would panic. I would flip out, right? It's my fault. It would kick me further down, right? I was moving away from what my actual goal was. And if one of your worries or your fears or your anxiety about pursuing bariatric surgery is not hitting a goal weight that you have had up here, if that number is tripping you up, this conversation should serve as evidence for you that it doesn't have to be that way. You can actually flip the script that you have been telling yourself. Because in the countless conversations that we've had with experts on this podcast, they basically all say the same thing. Losing excess weight is like a byproduct. It's like almost a happy accident of the surgery because it's a metabolic disease and the surgery helps you fight back against these metabolic issues that are going on. So weight, happy accident, right? Lower blood pressure, cholesterol, inflammation, right? You go through the list. So if you sit quietly with yourself and you go, I'm just terrified to have surgery because what if I go through all of this and I never reach that goal weight? Flip the script on yourself. This is not your fault. And that number is not actually a number that is really great at determining what your overall health is. And there are providers out there, just like Dr. Shariff, who are here to help you flip that script, which goes back to what she said earlier, which is what we've been saying so many times on this podcast. Shop around, ask the questions, find the provider, find the community, find the experts that are really going to help you not only flip that script, but continue to live that flip script as the disease is working overtime to get you to go back to the person that you were before.
Yeah. Well, and especially as somebody who's come from, as Natalie, and myself both come from multiple surgeons and different experiences, I, tell you that the surgeon that just cashes your check and sends you down the road is much, much different than the surgeon that actually wants to be involved in your care and that you feel like you can go back to and say, hey, listen, I'm struggling, or this is what I'm looking at, or why is this feeling this way? Somebody that you feel like you can continue to meet up with and talk to and have that person behind you means all the difference in the world, because I never felt like I could do that with my previous surgeon ever. And so the fact that I could, the second go round just made a huge difference. Like, I can talk to him now about anything. I texted him just yesterday about something that I was asking about, and he was right there to text me right back and tell me. But another thing that Dr. Shariff said that I wanted to talk about too, that I wanted to kind of circle back to, was the fact that, when you're talking about these, the non-scale victories, the confidence, the things that you can, that you come with, is we find a lot of times that when we are at our heaviest, we settle for a lot of things. We settle in relationships of all types.
Oh my God.
Working relationships, personal relationships, friendships. You see your friend circle may shift, all these things. When you finally start to realize that you're not just somebody who can be talked to any kind of way, or you're not somebody that's just a people pleaser, or you're not here, people want you around for more that, you're just happy that people want you around when you're at your heaviest, because you don't feel like you're valued and you don't have any value any other way. So if you just continue to do everything for everybody, people will love you and they want you to stay. And then once you start kind of feeling yourself a little bit and being like, wait a minute, I don't like this, doesn't feel good. I'm not getting anything. This isn't a reciprocal relationship. What I'm feeling is I'm doing a lot for everybody. Nobody's here for me. And that's when the changes start to come about. And I love seeing that awakening in people, because it's just amazing to see people take back control of their lives in that way.
And I say this to my patients all the time, especially young females. I said, do not go finding a relationship. You are at your weakest now. Come back in strength. And for me, that's what fuels my passion. I see this timid girl come and sit down, talk, confused, not sure. And then you see them from that point to the sassy, snappy person, right? Who's now going on to achieve their dreams. I can't tell you how many of my patients I encourage them to, carry on. They either become RN, RNs become NPs, or, whatever they want. You cannot make this big life decision when you're at your weakest point, especially when it comes to your life partner and all that. I actually have a good patient, a friend now, whose partner left him, and for whatever reason, and he had not a single person to support him. And now that he has gone through this process, he's building his community again. This time around, there will be people who are going to cheer you on. It's easy to find friends when you're at your weakest, like exactly like what you said, because you are more like a people pleaser. And it's easy for us to offer, sympathy and, because it makes you feel good that, oh, I'm not in that situation, right? But it's super hard. And I say your true friends are the ones who clap when you're standing on the podium. Who stands when you're lifting that trophy, if they're clapping, those are your true friends. So I said, good riddance. See, another advantage of doing bariatric surgery, you get rid of all the negative people in your life.
It's so true. I have said it many times on the podcast and in our community, outside of our community. I have lost, over 150 pounds. Awesome. That's great. But the community of people that I have gained, I have met people that I could never have thought or dreamt of meeting and becoming friends with. April and Jason being two of them. There are relationships, friendships that I have accumulated that have only built me up. And it wouldn't have happened if I hadn't said yes to myself. And as you said earlier, taken that first year post-op to really work on myself and to build myself up. It was phenomenal. I'm so glad that I did that. It was hard and it was messy and it wasn't pretty. I would say that. But the gain that you get from moving past that fear, from choosing to fight, as we're saying often in this episode, it truly is surreal. And I'm so glad that you said to shoot for the stars, dream up the most ridiculous in your head thing. Who would have thought? I never thought I'd have a podcast or that I'd be able to travel the United States and talk about, obesity and help other people. That was my wildest dream. And I'm doing it because I chose myself, because I was able to make that decision. And it's just incredible the things that happen just from choosing to fight your disease. It really is.
Natalie, that was beautiful.
I think the thing that we have been typing and saying the most in BariNation is, isn't it amazing what we gain when we lose? Right? And
love that.
Right? And it goes a lot of ways because this disease is doing everything it can do to keep you small, to keep you isolated, to keep you from the person who you want to be. Because the disease knows that if you were able to tap back into who you really are, it would be toast. It knows that. It knows that. And it is fighting you every day against this. And one thing that you can do to put the disease on notice is just simply say, I'm going to consider this. I'm going to consider bariatric surgery. I'm going to think about having this. I'm going to watch another podcast. I'm going to listen to this. I'm going to Google what bariatric surgeons or obesity medicine specialists are in my neighborhood. That one thing is putting the disease on notice. It's letting it know that you are aware of it now and that you are not going to ever not pay attention to it again. Because you are going to lose a lot of things when you go through the bariatric process. And some of those things are going to cause you tectonic grief. They just are. You are going to lose things that you thought you couldn't live without. You could lose people. You could lose relationships. You might even lose sight of yourself along this way. So losing is not always right in the term that we think it is, like, oh, I'm losing weight. You are going to lose some things. But the thing that you have to know is that that loss is freeing up space in your world to grow, to gain, to go the places that you want to go. And you are going to have to become a brave fighter and continue to fight this disease each and every day. But at the end of the day, as Jason, Natalie, and I, and Dr. Shariff are here to say, you will be amazed at what you gain when you lose.
Spot on. Spot on. I think that is the thing. The first step, like you said, is changing your mindset. It comes down to changing your mindset. And there is science behind that, if I may bore you guys.
Go away.
So people who have this victim mentality, right? They think of themselves, and again, it comes back to the relationships you attract. People feed into that victim mentality. Oh, you had this happen to you, that happened. And when you switch the flip or flip the switch, and then you go down and become a victor, when you're a victor, then those same people go away. But how are you changing your mindset? What does it mean to change your mindset? Like, a lot of patients ask you, like, what do you do practically? So I say, give them a simple exercise. I say, look at yourself in the mirror. Start with 3 seconds, because a lot of patients can't even look at them for 3 seconds, and then work your way to 10 seconds and longer, and say you're worth it. Now, I'll give you the science behind that. Sounds, cheesy. Why are you doing that? Looking at the mirror and say, I'm worth it, or I'm beautiful. Whatever, positive affirmation. Positive affirmation causes new brain pathways. It's called neuroplasticity. So new brain tracts are formed which reinforces that. So the more you reinforce, the more you believe. So it goes for the negative thoughts too. The more you think it's your fault, the more the universe will make you believe it is your fault. So this is where mindset, it starts with one simple thought. And I'm no psychologist. I'm sure you have had psychologists come here and talk to you guys about it. It's one thing. And how do I know? Because I was one of, when April called me first time around, I shared a little bit of my journey. I come from India. Then I went to England. And in England, from India, I was the top doc, medical student, got all the scholarships, blah, blah, blah. And I go to England and I'm nobody. Slowly, I fell into that victim mentality. Like constantly, everything was someone else's fault and something was happening to me. I couldn't rise. And one fine day, it starts off with one little thing where you say, stop. It could be a simple word as stop. You're not doing that. And I truly believe that we are universe within ourselves. We have the ability to tap into any energy. I really believe that. I am a big Star Wars fan. I really believe we can control things. It's up here. We have the force and we can really control that. And it's not the way it shows in the movie, bright lights come in. But there is something that happens when you decide to choose you. When you decide to write your own destiny, it happens.
Yeah. I challenge people a lot when they're having, negative thoughts. One of the things I say is the loudest voice you're going to hear all day is the one inside your head. So make sure that it says kind things to you. But I also make sure and tell people that I want you to practice for every negative thing you're going to say to yourself. You need 3 positives to follow that.
I love
3
that.
positives to follow every negative. And then we're going to see how long it takes you to spin it. And eventually, and I tell them, they're like, what if it's repetitive? I don't care if it's repetitive. Your negative thoughts are repetitive. Why can't the positive ones be repetitive? It doesn't matter. It doesn't matter what you say, as long as they're positive thoughts. Like it's the same science, regardless of how you decide. It's what you choose to hang on to that makes the difference.
Yep. In BariNation, we believe that there are 4 pillars that we need to live towards. We need to practice every day. It's movement, mindset, metabolic wellness, and community. And we chose all of those words for a very specific reason. And I think all of us on the screen would agree that mindset piece is the biggest one to tackle. It's important as all the other ones, but a lot of your behaviors start with what you're thinking up here.
Right.
And in BariNation, we practice changing our mindset. And just like what you guys said, the very first thing to just become aware and to practice that is to catch it. What am I saying to myself? Can I catch that thought in the moment? You don't have to do anything else. You catch the thought. So if you've been watching or listening to this podcast and you think back to some of the things that you thought when we said something, right? If we said something and your brain instantly was like, oh, no way, that's not right. Or that can't be true. Or why is this? Why is that? Catch that thought. Just catch it and don't require yourself to do anything else. But it's these conversations, it's these moments, it's these tools, it's this learning that helps you gain while you lose. It's what we call the work of weight loss surgery, even though we know it's not weight loss surgery. It just comes out of our mouths easily, right?
Yeah. And that's how people recognize this. I'm finally getting to be fine with that. And also the important thing is be kind to yourself, right? Compassion has to start. You can be compassionate to everyone else. And I see this. People are taking care of your families, kids, everything else. And I'm like, why are you not compassionate to yourself, right? And then remember, progress is never linear. It's not like this. It's not like you're going to climb this graph. It's going to be like this, then down and up and down. And it's okay. That's fine. Yep. As long as you don't give up, you don't lose.
Yeah. Yep. We say this all the time. Pause and pivot, right? We need to give ourselves space and grace. We acknowledge that this bariatric journey is not for the faint of heart. But as 3 patients sitting here, we know how hard life was before surgery. We know how hard life is now after surgery. And all 3 of us would continue to choose the bariatric life over the life that we were living before onboarding this life-saving treatment. So yeah, this is not your fault. This is not your fault. And it might take you a long time to really understand that. That's okay. Jason, Natalie, and I, every day, there's a thought that creeps up there that goes, it's there. But every day we choose to fight, and that fight looks different. And we are part of a community where we get to learn new tools and onboard more weapons, if that word makes sense for you. But every day we choose to fight. And because we're choosing to fight, we have access to a life that we could have never envisioned for ourselves.
That's awesome.
It's worth it. It is worth the fight.
And 99% of my patients would agree with all three of you.
Yeah.
I can't say 100 because nothing in life is 100%. So that's something that people have to understand. Patients have gone through this process. The only regret they have is why didn't they do it earlier?
Yeah. Yep.
I say this.
Yeah.
I say this to my patients, and I'm going to put it out there to your audience. Think of it like a cancer. The smaller the cancer, the smaller the surgery. The bigger the cancer, the bigger the treatment you need. So come to us early so that we can help you fight this disease.
Yep. Amazing. All right. I know we have covered a lot in this conversation, which is always the case, but that's why these conversations are so important and so meaningful. So I have a question for all four of us. And the question is, right? We hope this episode is reaching you when and where you need it. So whether you're pre-op, post-op, whether you're thinking about having surgery, this is our hope. My question to all of us is, when you hear that phrase, it's not your fault, but it is your fight. What is the one thing that you want people to think about, to connect with, or to remember when they hear that phrase? It's not your fault, but it is your fight.
For me, I would say I want people to use the energy that they would use tearing themselves down for being in this position, for having to have the surgery, for needing the help, for needing all those things. Take that energy and conserve it, because you're going to need it for the fight that's ahead of you. Because every single day you're going to need to choose yourself. You're going to need to choose what you want most over what you want right now. You're going to have to make hard choices every day. It's going to take that energy. So let's not waste the energy trashing ourselves for being in the position that we're in. I can say that from experience because I've been there twice. And just conserve the energy and use it where it's needed.
Awesome. Nat, what about you?
I would say everyone has their thing. Everyone has their fight that they're fighting, whether it's physical health related, whether it's mental health related, whether it's family, whatever the thing is, everyone is going through something and everyone is having to make their decision every day to fight. This is just mine. And this is yours if you're listening. This is our thing, but it's not just happening to us. Every single person on this earth has something that they are working through and fighting toward.
Oh my God. Truth. Yeah. Mine would be, you are already a fighter. You have been fighting for probably your entire life. Pick up a new tool that you've never picked up before and see what the fight is like with the right tool.
Yeah. Wow, that's powerful. That's awesome.
Dr. Shariff?
Yeah. All right. For me, it's all about mindset. I want them to have an identity shift. Move from being someone who looks at themselves and see a broken person. Flip that and into someone who's rebuilding their crown. Now, the crown can mean anything, right? So it can be looks, it can be mental health, it can be playing with your kids. Go claim your crowns, right? And this is where I just want everyone to understand. We rule our lives. Take control. You are the one who has to control your life. No one else. No disease. Nothing controls your life. You control your life.
Dr. Shariff, we can't think of a better person to have this conversation with. Thank you. Thank you.
Absolutely.
It's been inspiring. I know I've had quite a few like mind-blowing aha moments. I'm sure our listeners and our watchers are as well. Dr. Shariff, if people want to connect with you, maybe they're interested in onboarding you as a surgeon, or they want to follow you on social media, they want to keep learning from you, where can they do so?
So, keeping with the theme of crown, you can find me on social media as Robot Queen. I love the robot. I do robotic surgery. And it started off as a joke in my ORs. I'm the director of robotics. So they said, oh, the queen is here. So the robot queen is here. So it started off that and we ran with that. And I'm like, it fits in well. We all need to go restore your health, reclaim your crown is what my tagline is. So you can find me there. It's like, for me, the most important thing is motivating people. It's not just about, me being your surgeon. If I can make a difference and if I can inspire you to go claim your crown, that's all my whole aim is to come here. So yeah, you can find me on Instagram, Facebook, and TikTok. I love TikTok.
TikTok, oh my God,
I don't know.
It's a beast. It's a beast of its own.
It is, but it's so much fun.
It's so much fun. Well, and we know that you have definitely inspired people by having this conversation. And friends, we will not only link how you can follow along and connect with Dr. Shariff below, but she mentioned some research articles. We'll make sure that we also link those below so you can continue your learning. And this might be an episode that you watch again and again and again. Awesome. Great. Share this episode with somebody who you think needs it. Rewatch it as many times as need be. And if you have a question that comes up based on this conversation, let us know. Drop it in the comments of this episode or send us an email to hello@BariNation.com and we will send that off to Dr. Shariff and we will get your questions answered. Our mission here at BariNation is to not only empower you to tap into this life-saving surgery, but to get the education, the tools, the resources, and the community that you need to thrive pre and post-op. So if you have a question, we want to answer it for you. All right, friends, I think we did it.
Yeah.
Absolutely amazing. Dr. Shariff, thank you so much for joining us today. And hopefully we will get to welcome you back soon.
Absolutely. See you guys later. This was one of the best ones I've done. It's so much fun.
Told you.
It was so much fun.
Awesome, you guys. Thank you so much. Woohoo! All right. We're going to hold you to it.
Right.
All right, friends.
Absolutely.
Thanks.
Bye, everybody.
Talk soon.
That wraps up another empowering episode of the BariNation podcast. If you enjoyed today's episode, keep the conversation going by joining the BariNation membership community, where you can attend live support events, access on-demand resources, and find a caring community.
Join us at barination.mn.co. If you found this podcast valuable, help us produce it by becoming a $5 monthly supporter at BariNationPodcast.com.
And just remember, at the end of the day, you've got this, we've got you, and we'll see you next time. Bye, everybody.